what I'm intending to do today is speak a little bit about how we can use printing technologies to make drugs or drug delivery systems. And this is another twist to individualized dosing or therapies. First, I will just tell you generally about printing technologies, how they can be used to personalize products, and then I will give you some examples of fabrication of drug delivery systems by printing and some of the research that we have done at Akademi over the past 6 years on printable medicines and how we can work with printing technologies in dose tailoring, for instance. Then finally, I will go into some details about a new startup company that works in this field that we have just founded. 3D printing is on the news every day, basically. We can do a lot of printing by this approach. So you might have heard of printing of houses. This is an example of a printed house, a house that was printed in 24 hours. There's a lot of examples from the design industry, clothing industry. We can see some clothes and shoes on the pictures here. And jewelry industry, tailor-made jewelry, tailor-made pieces of art. So it's changing the way we manufacture a lot of the things that we are having around us. Why 3D printing? Well, it's basically a way to allow mass customization of products. So this is the big thing. And products can be produced where they are needed. So there's a flexibility and on-demand perspective to this. And the digital design allows us to build in new levels of complexity in the structures that we have. If you look at the picture on the slide here, it would be almost impossible to produce with conventional technology. And also, there's the environmental aspect to this, and many times this approach can be energy and material efficient. Is this realistic for drug products then? You might have heard that the FDA just recently approved a first 3D printed drug. It's an anti-epileptic treatment, and the company Pharmaceuticals in the US, they are able to demonstrate a qualitatively good manufacturing process which is based on 3D technology. They are producing a tablet that is very hollow and porous, and that allows the drug or the drug product to disintegrate very fast, and this can be very advantageous in the epileptic seizure treatment. So it is reality. This drug is produced in the company, the normal routes. It's not bringing the manufacturing closer to the patient, but I think it's a nice demonstration that printing is reality in drug production as well. So we can get personalized solutions using printing technologies, and these one thing that I want to convey in this talk is that there are a lot of different types of printing technologies. When people speak about 3D printing, it's not just one type of technology. It can be many types of approaches. And then we can use printing in a more two-dimensional way. So depending on the application area, we can speak about 2 or 3D printing. So, however, this allows us to work with tailored medical devices. It allows us to individualize dosing of drugs, combine drugs in a new way to multi-drug systems. So there are a lot of opportunities using printing technologies. If we, for example, now take an example from our research lab at Akademi University, how inkjet printing, for instance, can be used in this context. Usually these are drop-on-demand technologies, which means that drops of ink are only ejected when required. We can work with uniformly spaced and sized droplets. We can create precision patterns, which means also that we can have very, very accurate deposition of the drug, and then the flexibility in dosing. For instance, some of the pictures here in the back, the colored picture, for instance, there's an increasing dose with 8 micrograms per square from the upper corner to the lower right-hand corner. That's just one example. Then the yellow printed areas are increasing doses in the middle of vitamin B. So you can see that you can start really accurately dosing your drugs. This is another example. It's 3D printing of medical devices, which was made in collaboration with Bayer, and we're really thankful of that interesting collaboration. So basically, by digital design, you design your product, you print it, and then you have your medical device. This, in the future, can allow flexibility in design, tailored devices based on the patient needs regarding size and shape, tailored functionality, which means controlled drug release properties, tailor-made treatments and devices. So this is one example how you can use 3D technology in the future. We have worked a lot with developing ink formulations for inkjet printing, working with substrates which take up the drug, and those can be then tailored treatments and drug delivery systems. So by digital design, we tailor the dose, how much material we want to deposit on a film, for instance, that will dissolve in your mouth. And why do we want to do this? We have heard about the personalization and the diagnostic approaches here. So in combination with these, we need to then be able to tailor doses. So there are age-appropriate dosing in the pediatric population or the elderly geriatric population. So we have needs that come from different patients. We might have low doses, high doses. Somebody might be a fast metabolizer, somebody a slow one, and so on, so on. But this is also true for in the veterinary medicine side. So we also, apart from the facts that I just stated, we have species-related specific issues related to dose, delivery systems, taste, and administration. And this brings us to the development that has happened over the past few years. You've heard about some of the examples that we have done in the research over the past 6 years. And now we are at the stage where we have been able to start a company, Kide Technologies, and the business activities will start next year around these themes that we have talked about. What Kide brings is we want to bring some treatments closer to the patient with a lean production based on demand method, faster availability for some types of drugs, personalized therapies that are not possible to be made today, but through a modular mobile manufacturing approach, also with integrated quality control, so every dose will be quality controlled. The business is basically a service network for individualized treatments between pharmacists, patients, and medical doctors and veterinary medicines. Finally, I just want to introduce the people. We are people with different backgrounds, and in the future, we are looking for partnerships in the area. So we would be really pleased to meet some of you people who get interested to work further to develop these concepts. And finally, I just want to thank you for listening, and I'm pleased to discuss with you after the session if you have any questions to ask. Thank you.